You're on. Go ahead, your chart. Okay, so it's Virginia from North Carolina?
That's right.
It's not North Carolina from Virginia? No. All right, so you and I know each other.
Yes.
We met 11 years ago?
11 years ago in Durham.
In Durham, North Carolina. Good. How's North Carolina?
It's hot.
It's hot. You haven't seen hot yet.
Somebody told my husband that North Carolina not hot enough for him to go to Las Vegas.
Go to Vegas, right. Good. Well, welcome back. So you had a mini gastric bypass in 1999. 1999. Right. We actually have one of the nurses who worked there who works here now.
Oh, really?
Yeah, she worked on my floor over there, and she's working here now. And do you remember how long the surgery took?
I want to say 30 or 45 minutes.
30 or 40 minutes, right? And you're in the hospital 1 or 2 days?
I believe it was 2 days.
2 days, yeah, back in the old days, okay. And you weighed at that time about how much?
I want to say my highest weight was 300, but I believe I lost down to about 260, 240.
Mm-hmm. So right prior to surgery back then, you were somewhere between 240 and 300 maybe?
Yeah.
Okay. And you had surgery, out 2 days later, and then the past 11 years you dropped to a low
of about 130.
About 130.
For about 5 minutes.
For about 5 minutes, right? But most of the time during the past 11 years you've been about
140, 150.
About 140 or 150. And then over the past, how long you started to gain some weight?
The last year, about a year and a half. Total about 50 pounds.
And you gained about 50 pounds,
yes.
Right. And you ask, I think, a good question, which is, how comes? Why did this happen? And you were saying, well, maybe you're eating more, or that you stretched the pouch or something like that. And my opinion is that's not your fault. That's the surgery and your gut adapting. Okay? So what we talked about yesterday is that if during the past 11 years, if you'd been in the gym every day, and if you did 100 push-ups and you did 100 curls with 30-pound weights, you would be very muscular, right? Because your muscles would build up from every day. Every day. And during that time, that 11 years, food has been going through your gut, and the studies show if you have kids with what's called short bowel syndrome, the gut adapts. The lining of the gut, which digests and absorbs food, is like a shag carpet, and when you shorten it, it begins to grow back. It gets thicker and longer, and so your gut now can eat more, accept more, because it's had an MGB for a long time, just like going to the gym for a long time. It's better able to adapt. And so that's what's happened probably with the weight gain. And what we do for revision is we look inside, we look at your stomach pouch, and we trim it, make it smaller, and then we bypass some more to try and get you back your weight loss.
Okay.
Besides the weight gain, have you had other complications from the MGB?
Just the iron.
The low iron?
Yes. I get IVs.
There's new information about iron, and I'd like to tell you about that.
Okay.
Before I do, I'm going to do that video for everybody.
Okay.
Are there other questions that you and I should talk about, or anything else that your husband had on his mind that we want to talk about this morning?
I've heard a lot over the years about this, and plus what I heard here.
Mm-hmm. Good. Are you happy? I mean, did she have a good result from her MGB? Would you say overall?
Oh yeah, yeah. And like she said, it's only been in the last year and a half.
But prior to that, then, she had a good result from her MGB?
Sure.
Okay. Good. Well, why don't we stop then? You have other questions, and I'm going to give you a little video on iron, and this will be up on YouTube, so you can see it again and tell your doctor about it and stuff like that. But I'm going to give you an update on the latest research on iron, the IV iron, what to do, and the new oral kind of iron. So I'll talk about that if that's okay.
That's fine.
Okay.
You don't take any medication?